This can be incredibly frustrating to patients. They're suffering from all this pain, they have this negative MRI, and their doctors are saying, well, we can send you to physical therapy. In cases of SI joint dysfunction, physical therapy can potentially be really beneficial, assuming that the ligaments of the SI joint are intact and they have a lot of integrity. In patients where they've suffered an injury to the ligaments of the SI joint, they have inherent instability, which I'll talk about, and their MRI is still normal or negative, and they go to physical therapy, but now they're failing physical therapy, they can lose a lot of hope, which is really unfortunate, because people with SI joint dysfunction can have a lot of pain. If we look back here, this is a really zoomed in image, but I want to show you, this is really of the low back. So your tailbone is down here, this is your sacrum, and then these are your ilium, like the big bones that come out on your hip. All of these white tissues here are ligaments that represent your SI joint or your sacroiliac joint, basically the connection between your sacrum and then this big bone on your hip. If these ligaments get injured, think of them like rubber bands. You can kind of stretch a rubber band to the point where it doesn't recoil back, right? It's pretty loose. That's what can happen to these ligaments, and it can be very, very painful. Like ligament injuries, they're no joke. They can be very painful and cause a lot of dysfunction in the low back. And in patients that have this SI joint dysfunction, this SI joint laxity, these are ones that are going to fail physical therapy, because you can't build muscles around your SI joint very well if you don't have strong ligaments here. And not to say that physical therapy might not help a little bit, but it likely is not going to resolve your pain if you're suffering from underlying instability here. What can also happen in these cases is people have this low back pain, and maybe it goes down like into their butt or the back of their leg. And again, nothing might show up on MRI, but what could be happening intermittently is that these ligaments cause excess motion of these bones, which then, your sciatic nerve is right here, which can then transiently or intermittently push or press or apply pressure on your sciatic nerve and give you temporary sciatic symptoms. A lot of times in SI joint dysfunction, this will start intermittently. Like patients will say, oh, I had some low back pain. Every once in a while, it shoots down into my butt or the back of my leg, but it's only every once in a while. Well, then that starts getting more common to the point where that pain can actually become constant if up here is not addressed. What can also happen in patients with sacroiliac ligament laxity is the sciatic nerve may not actually be getting pinched, but they'll get referral pain down their legs that might mimic sciatica. And what can happen, if we look at this picture here, up here, all these dots are representative of ligaments here in that sacroiliac. So we have, posterior sacroiliac ligament all through here, iliolumbar, which is actually just right on top of the sacroiliac here, and then you have these referral patterns down the leg. So if we look here, people with like posterior sacroiliac ligament laxity with SI joint dysfunction can actually have pain that kind of shoots down the side of their leg, maybe even a little bit into the front of their thigh, or even down on the side down here of their calf into their foot. Now that's not a pinched nerve. That doesn't mean that they have a pinched nerve or that the sciatic nerve is really even getting irritated. That's simply just referral pain from an injured ligament. When people come in with this low back pain and this intermittent, what we would maybe think of radiculopathy or a pinched nerve, it actually just could be from ligament laxity. In some cases, patients may try all the traditional therapies for SI joint dysfunction and not do well. All the meanwhile, their condition gets worse and worse to the point where they may actually be recommended for an SI joint fusion, which is an operation where surgeons will actually fuse that sacrum and their ilium together. What's interesting about that is even just papers in 2017, which is not that long ago, are saying there's really no indication for that. The research does not show that that actually is a really good viable option long term. Can it help temporarily? Absolutely. But long term, 10, 20 years from now, it actually can do more harm than good. If you fuse that joint, what happens is then a lot of pressure is going to go to your hip or the other SI joint, or even above into your lower lumbar segments. And typically those would then get degenerated and overworked to the point where maybe you undergo more operations unnecessarily. At Caring Medical, in these cases of chronic SI joint pain and dysfunction from injured or loose or lax ligaments, instead of surgery, what we do is we actually treat those ligaments and treat that joint comprehensively with prolotherapy or PRP, or platelet-rich plasma, or a combination of both to actually get those ligaments to heal, get that pain to go away, and get your pelvis to remain stable so it's not going to even be pressing on your sciatic nerve or other nerves. Behind me is a picture of this. Injections, these are facet joints, but we'll actually do injections into the sacroiliac ligaments and sacroiliac joint as well to work on rebuilding all of those tissues as a unit, rebuilding that joint as a whole for stability and long-term pain relief. Studies show that patients that undergo PRP and prolotherapy for their SI joint actually do very well long term in terms of pain reduction and increase of function. It's one thing to get your pain to go away, but another thing to also get that joint strong enough to be able to allow you to live your life and be active with your kids or your grandkids, or exercise the way you want to do, or simply get up off the floor and walk to a chair. Everyone's goals are different, but the results are very promising for prolotherapy and PRP in cases of SI joint dysfunction.